Hi, my name is Dr. Jane Hendricks, and I want to speak to you a couple minutes in regards to stem cell IVs and specifically the conditions of IBD, irritable bowel disease, Crohn's disease, and ulcerative colitis. We've been getting great results with these conditions. If you know anyone with one of these medical conditions, you know how the quality of life is very much affected. Some patients will have 10, 12, 15 bowel movements a day with blood. And so it's extremely disruptive to a work schedule, to a social life, not to mention traveling. And a patient that I just did, it's been 7 months out. I like to check 1 month, 2 months, but we want more of the long term when stem cell treatments come into play. We want to check long term. So for example, I've got one patient that's been 7 months out, doing great, was having about 10 bowel movements with blood a day, so very much affecting his work life, his social life, couldn't travel except to drive, and now he has 1 to 2 normal bowel movements a day, so he's so happy, in his 20s, so his life has completely changed. Usually he gets sick during flu season, cold season. He'll be the one that gets sick multiple times, and most patients with autoimmune conditions will get sick because they have a deficient immune system due to the increase in infections and the autoimmune component. So he was excited to realize that his immune system had balanced to such a point that he didn't get sick not one time in 7 months. And this video is being played in the middle of COVID season. So not only did he didn't get the regular cold and flu, he was protected from COVID. So he was extremely excited. He gained 15 pounds. We have another patient that's almost 2 years out that gained 20 to 30 pounds. One thing to consider is the source of stem cell. The source of stem cells. So you want umbilical cord Wharton's jelly. That is the source I use. If you have an autoimmune condition, you do not want to get a treatment with adipose. Sooner or later, that treatment will stop, but the big choice is between maybe bone marrow. However, that's more for joints. So you might hear about adipose, and then you will hear about umbilical cord. Why not adipose? For one thing, you're ill, so you have an autoimmune condition. So there's a likelihood of infection if the treatment is from your own tissue, your own adipose. Also, they're just spinning it down in the office. It's not processed in a laboratory that's audited by the government. So the laboratory I use is under 24-hour surveillance by the government. So there's no risk for infection. These stem cells have been used to treat about 1 million patients, and there has not been one adverse event reported. The stem cells are harvested right here in the States from San Diego hospitals. They're used in Mount Sinai, veterans hospitals. So the source that I use for my patients is absolutely the premier source for the United States. So that's what you want to go with, and I do have a link to that on my website. Also, this particular source is the only source in this country that can offer the number of stem cells that is needed by an average weighted adult, according to the studies that are going through right now. 90 million stem cells is what my patients receive in just one treatment. Again, this is the only lab that can get up to that number. For joint injections, you can get away with 10 million, 20 million. However, if you're doing a systemic IV, we want to get up to the 90 million and have those stem cells counted, since that's what you're paying for. For more information on the stem cells, feel free to call my office, 480-535-7868. There's also lots of information on my website. You can take a look around. I do free consultations for anyone that's interested in getting a treatment. And you can come in and you can bring your imaging. If you're long distance, you can email or fax the imaging, and we can do it by phone and decide if this will be the best treatment for you.